Assalamualaikum warahmatullahi wabarakatuh. I am Madam Nazira Zubair. This video still on chapter immunology, but we shall discuss and elaborate further on the concept of self, non-self, organ and tissue transplant. So our learning outcomes, or LO, in this video is to explain the concept of self, non-self, and its importance in organ and tissue transplant. Alright, before we go further, let's recall and recap a few important terms in this particular subtopics. For example, like antigen and MHC. Can you still remember those terms? Hopefully you can remember because you have learned this in previous subtopics. Okay, when we talk about the antigen, what is antigen? Antigen refers to foreign substance that can elicit and evokes B and T cell response. Okay, that is antigen. When we talk about this MHC, MHC stands for Major Histocompatibility Complex. Actually, it refers to the host protein that displays antigen fragments on the cell surface.
The immune system has the capacity to distinguish between body cells, which is self, and foreign materials or non-self. It will react to the presence of foreign materials with an immune response that eliminates the intruding material from the body. All nucleated cells of the body possess unique and distinctive surface molecules that identify it as self. Any substance that is recognized as foreign and is capable of triggering an immune response is called an antigen or non-self. Before we discuss on transplants or grafts rejection, let us look at a definition of a transplant or graft. A transplant is an organ, tissue, or group of cells removed from one person, the donor, and transplanted into another person, the recipient, or moved from one site to another in the same person. A skin graft is a common example of a transplant from one part of a person's body to another part. Some organs and tissue that can be transplanted include liver, kidney, pancreas, heart, lung. In transplants or grafts of an organ or a piece of tissue between individuals, these different forms of MHC molecules can act as antigens, stimulating an immune response that leads to rejection. Tissue typing is a procedure in which the tissues of a prospective donor and recipient are tested for compatibility prior to transplantation. Mismatched donor and recipient tissues can lead to rejection of the tissues. There are multiple methods of tissue typing. To minimize rejection in a graft or transplant operation, physicians use donor tissue bearing MHC molecules that match those of the recipient as closely as possible. In addition, the recipient takes medicines that suppress immune responses. Transplants of bone marrow from one person to another can also cause an immune reaction, but for a different reason. Bone marrow transplants are used to treat leukemia and other cancers, as well as blood cell diseases or hematological diseases. Prior to receiving transplanted bone marrow, the recipient is typically treated with radiation to eliminate his or her own bone marrow cells, thus destroying the source of abnormal cells. This treatment effectively obliterates or wiped out the recipient's immune system, leaving little chance of graft rejection. However, lymphocytes in the donated marrow may react against the recipient. This graft versus host reaction is limited if the MHC molecules of the donor and recipient are well matched. Sites with immune privileged are regions that are naturally less subject to immune responses than most other areas of the body. Immune privileged sites include brain and cornea. So for brain and cornea, foreign tissues are accepted. Why? Because they lack of circulatory vessels and thus have little or no access to lymphocytes or white blood cells.
Alhamdulillah, in this short video, we're able to elaborate and discuss the concept of self, non-self, tissue and organ transplant, as well as graft rejection. So hopefully everyone is clear on those concepts. Alright, till we meet again in the next video. See you. Assalamualaikum warahmatullahi wabarakatuh.